The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good evening. We hope you had a great weekend and everything's going A-OK. Thank you for tuning in. This is our last of 5 shows this weekend, and we have a lot of new news and new cases and new information to provide you. And of course, if you have questions, just call us. We are live in the WOR studios. You can call us at 1-800-321-0710. Again, 1-800-321-0710. This is Dr. Lederman, and we're talking about news to hopefully make your life better, your health better, to make your life of your friends and family and loved ones better. So when a difficult decision strikes, you're better informed. And there's lots to talk about, so let's get right into our news and patients. And again, you're welcome to call us. First patient I want to talk about is a woman, New York City police officer, woman who's premenopausal. She's had 2 children, and in 2010, she noticed a lump in her right breast. Never got treatment. So what happens when you have a breast cancer that never gets treated? Well, by 2013, 3 years later, it broke through the skin and ate through the breast. So there's no more breast. It's all a mass of cancer. It's bleeding and infected. She had a biopsy, and the biopsy was positive for cancer. They also did estrogen and progesterone receptors. She's had holistic treatment only, and what she described as tons of alternative medicines, vitamins, antioxidants, tons. And did it help? Well, no. The cancer spread to the other breast, so the left breast now is markedly swollen and very hard and discolored. That's been that way for about 3 months. There's, as I say, total destruction of the right breast. She did get a PET scan this year in April, and that showed extensive cancer in the right chest wall area, the left breast, and bone metastasis. She came in on Thursday to see me to talk about treatment options. Right now she has trouble even sleeping because the pain in the breast is so great. And as I said, she had the PET scan done recently, which showed metastasis. So she has stage 4 cancer, but there's lots to do to help her. There's lots to do. So we got all the information together. We got the pathology. We got the PET scan, examined her, got her history, and there's lots to do to likely get her into remission, to shrink down the cancer. Right now she's very bothered by the bleeding and the smell and the infection on the right side and the pain on the left side. So radiation, radiosurgery will be very helpful for her. She's declining chemotherapy, but she's interested in hormonal therapy or pills, and her cancer is sensitive to hormonal therapy. So we spoke about options. Of course, in every patient is the president of the United States of their body. She's a new patient. She must decide herself to trust us or not, and to go with us or not. I gave her medicines for the pain, which was severe, and hopefully she'll think about everything we spoke of to try to get this cancer under control before, right now, it continues on its trajectory, which is terrible for her. So the point is, for everyone listening, if you have a lump in the breast, let's take care of it before it gets to this point. It's easy to do. You can just stick a little needle in. It's painless. Get the diagnosis and then decide on the best treatment, hopefully to save your life. And for this woman and others who have extensive breast cancer, well, there's good chance to get her in remission, to shrink down the cancer, to relieve that painful mass, to shrink down the mass of cancer on the right breast area, and to treat the cancer in the bones. So there's lots to do. We'll report back to you on this woman. Unfortunately, years of hormonal therapy has been missed, but she had years of alternative medicines which didn't help a bit, sad to say. And as a bookend, here's a story about a woman. She came in. She's a European woman. Came in. We treated her 3 years ago. She had a lumpectomy in the left breast. She had radiation. She had a small cancer. She had recent mammograms and MRI, and she's in complete remission 3 years after treatment, most likely cured. Of course, we don't say cured to anybody, but we can say most likely cured. She's had a small cancer, did very well. She preserved her breast. She's fully intact. She's active. She's vital. By the way, she had a son who came to me 20 years ago with an acoustic neuroma, lived in Europe, still lives in Europe, flew in for treatment. He heard about fractionated stereotactic radiosurgery for brain tumors, benign tumors also, like acoustic neuromas. We treated him 20 years ago, still in remission. Hearing intact, face intact, no adverse effects from her son. So in her family, thank God, we're 2 for 2. The mother, cancer-free 3 years after lumpectomy and radiation to the breast. The son, 20 years tumor-free in the brain, fully intact with hearing and facial intact. And by the way, there's a news article about women with dense breast. If you have dense breast, you may be getting a note from your radiologist saying, quote, your breast tissue is dense. So what does this mean? Well, up till now, women with dense breasts didn't know about it. But mammograms can miss about half of breast cancers in women with dense tissue in the breast. And 40% of women who have mammography have dense breast tissue, which means they have more connective tissue and fibrous tissue than other women who have more fat in the breast. So until recently, women didn't know if they had dense breast or not. And why does it matter? Well, now there's laws in state legislatures being passed from Hawaii, California, New Jersey, New York, requiring that women with dense breasts get notified. Why? There was a woman named Cancy Capello, a 61-year-old Connecticut woman, whose breast cancer had spread to her lymph nodes. This was in an article just recently in the New York Times by Carrie Rabin. And even though she had annual mammograms, it was apparently missed because of dense breast. So it became a source of inspiration to require state legislatures to pass laws, or to encourage them to pass laws, to require physicians to mandate that patients are notified. Now, the American College of Obstetrics and Gynecology does not recommend additional testing just because a woman has dense breasts. The American College of Radiology acknowledges that other types of scans may detect tumors missed on mammography. What other kinds of tests? Well, ultrasound or MRI, and those are certainly done in many women. Mammograms pick up 2 to 7 cancers per 1,000 women screened, and ultrasounds pick up another 3 to 4 small invasive cancers. So if you have dense breasts, you'll probably be notified. You may not know about it right now. So on your time of your next mammography, you may be getting a letter, and 40% of women will be getting this letter saying you have dense breasts. It's certainly something to talk about. And while we're talking about mammograms, breast cancer, there's a new machine out that takes 3D scans of the breast. So rather than two-dimensional views, which is what a normal mammogram does, these new mammograms, or tomomammograms, actually take multiple slices of images through the breast. This was an article recently reported by Belinda Beck. It was written up in the Wall Street Journal this past month. And Sarah Friedwald in the JAMA, which published their information, likened a 2D mammogram to looking at the cover of a book, while a 3D mammogram shows the individual pages. So imagine if a tumor were hidden on page 40 of the book, the tomomammogram would more likely show it. And what's the data? We always like to know the data. Well, in the JAMA study, it was published in the Journal of the American Medical Association, researchers at 13 sites compared records of 280,000 women who had digital mammograms alone with 173,000 women who had 2D and 3D versions. Adding 3D imaging decreased the rates of recall, meaning less women had to go back for additional views, which obviously no one likes. And at the same time, 3D mammography detected 41% more invasive cancers, finding 4.1 per 1,000 exams compared to 2.9 per 1,000 exams for digital. So is it worth it? What's the downside? Well, there's slightly more radiation to the woman. It's still well below the recommended number for a woman, so it's considered safe. It's more accurate. If you have dense breasts, you certainly may want to think about 3D or tomomammograms. And for every woman, you may want to think about getting more screening, better screening, so that you have a better answer about what's in the breast. We're going to break now. Again, if you have questions, feel free to call us. We're in WOR studio. We're live, and our number is 1-800-321-0710. This is Dr. Lederman from Radiosurgery New York. We're a dedicated private cancer center operating in the heart of Manhattan. Private means we work for you, not the drug companies, not the surgeons, not the chemo doctors. We work for you. We treat you like you're the president of the United States of your body, because you are. We're super convenient. We're located by most buses, subways, trains. We're just a few steps away from Grand Central, Penn Station, Port Authority, PATH trains. We take most insurances, Medicare, Medicaid. So if you'd like more information, please call us at 212-CHOICES. That's our direct office number, 212-CHOICES, which is 212-246-4237. Again, 212-246-4237. We're dedicating this show to Kwang Suk tonight, and we'll be right back with some new voices telling you about our work.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman. 212 choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique, and